Hey guys, Neela here from Teamio. I want to share with you guys something I did last week in my office, and I had amazing results. So I wanted to share that with you guys. So keep watching, and I'm going to dive into the details. So here's a bit of backstory. Because of COVID, I've been actually without a hygienist. When we closed last year for about 3 months, right before it all started in middle of March, my hygienist that I had actually ended up leaving. And when we came back to the office in mid-June, 3 months later, I actually put out an ad on Indeed and Craigslist. Unfortunately, I got no response, and the one single response I did receive was from a new grad who was asking me for $50 an hour. And for obvious reasons, I passed on that candidate. And fast forward to today, even for the last 2 months, I was still trying to catch up with my recalls because I don't have hygiene. I'm doing my own hygiene, and it just didn't make sense to follow up with patients when you offer them an appointment and you can't get them in for at least 4 to 5 weeks. And that's the reason why I had paused all my recall follow-ups through Teamio. So just this week, my scheduling coordinator and I decided to restart all of our recall follow-ups because we were starting to see a bit more openings towards the end of April and even beginning of May. So I want to dive right into the results after we made all these follow-up calls. So let's take a look at the week since we're done with this week. We made 29 follow-ups and a total of 16 appointments were scheduled. That's a 56% conversion rate. You can see a bit more detail on this chart where the calls were done only on Monday and Wednesday. Again, I'm only in the office 3 days, but my scheduling coordinator also goes in on Thursdays for office work, and I can see that she scheduled an appointment for someone she had been following up on. So if I look at the actual dollar value, what was added onto my schedule just this 1 week, in the first week of reactivating recall patients, that's $1,812. Not bad at all. At this point, we're still not going full force because I am not hiring a hygienist. I don't plan on hiring a hygienist until end of the summer or even mid-fall, especially because of a shortage of labor. I'm just not able to find a hygienist. So I've shown you the result. I want to just give you guys some key takeaways. I'm nobody to give you an advice, but after just, having talked to lots of doctors, especially in our client offices, as well as their team members and training them, even I learned lots of new things from them, and all different offices operate differently. So I've just come up with a few different key takeaways that I think will help you. So if your hygiene schedule is packed, obviously it makes no sense to continue to follow up with patients because you're not going to be able to get them in even within the next 2 to 3 weeks because you don't have an opening. I know it sounds simple. However, when I train some of these team members, they ask me questions, and I pretty much the simple answer is stop doing follow-ups because you just don't have room on your schedule. Now, if you're booked out for 2 months and you've got a good number of hygiene patients that are backlogged for recall, then it's a capacity issue, right? You've got to increase your hygiene hours. And how you do that depends on how you run your practice. But there are things you need to consider for that as well. As the provider, are you okay with having a second hygienist or even a third hygienist, even on the same day you're there? Are you able to take that load of handling your own patients as well as doing all those hygiene checks? So, just as an example, if you don't have a hygienist every day that you're in the practice, meaning you have a part-time hygienist only, then increase their hours first, of course, if possible. And once that hygienist is booked out, now you want to go ahead and hire another part-time if you've still got backlog of recall patients, and then go ahead and increase their hours as well. And to actually make sure this happens, your team has to keep up with consistently making these follow-up calls. Because every day that goes by, if you go into your scheduling software, specifically Open Dental, and you pull up the recall list, every day there's a new set of patients that are due for recall. So if the calls are not being consistent and you've got holes in your schedule, that's exactly what needs to be done. Even if you're not using Teamio, you can export the list of recall patients due out of Open Dental, export it onto like an Excel sheet, and format it in a way that allows you to keep track of who's being called, when they're due to be followed up on again if they don't pick up their phone, etc., etc. So you just need to have a proper system in place to keep doing this. So your team, and you can hold them accountable and they can stay consistent. So another important point that I want to mention is every practice is different. Whatever I say now, it doesn't mean that this is what applies. It works for me. It works for my practice. I'm mentioning a few key points because we work with large offices and we work with small offices. But every practice is different. You have to do what's right for your practice at that point in time. Now for me, because I'm not able to find a hygienist, I do my own hygiene, at least 3 to 4 recall patients a day. For me, it works. For some practices, it doesn't make sense for the provider to actually do their own recalls. It's kind of worked out for me because people are understanding and they're willing to wait a bit longer, maybe a couple of months, just because of with everything that's going on. I have no marketing cost. I haven't spent a dime in the last year and a half. I used to send flyers, direct mail flyers through Clipper magazine, and I did that for straight 5 years, and I stopped just a couple of months before COVID. And like I said, because at this point, I'm trying to focus on my existing patient base that I've built up in the last 7 years since I've started my office from scratch. But I know I can't keep doing this because as soon as I find a hygienist, I already have a backlog of patients who need to come in for the recall so I can keep them busy. Going back to the existing patients, by focusing on these patients that are already built up, I'm able to move some of these patients who waited on treatment I've recommended and actually gotten them to move forward with treatment. Because once you bring them back for recalls, you reiterate, you reemphasize the treatment that you recommended in the past, they're able to move forward. Not all of them, but at least some of them move forward. So that's added onto the production also. So with the reduced marketing cost, reduced payroll expense from not having a hygienist and also on saving payroll tax, and also adding to the production from existing patient base, my take-home income was actually higher by 15 to 20% than prior to the pandemic when I had a hygienist. And again, I want to say that this works for me, for my practice at this point in time, but it may not work moving forward. So you constantly need to pivot and adapt to what's going on around you. Now, I don't advocate not having a hygienist, but it works for me because I'm a much, much smaller operation than the majority of you. If you're a practice that has, more than one hygienist on a daily basis, you obviously can't go hygiene free. You can't just shift those hygiene patients over to the provider. It's just not going to happen. And last, don't treat your recall follow-ups or your recall reactivation as a big project. It doesn't have to be. Notice, as I said earlier, when I showed you my results, I was able to add $1,800 to my production without spending a dime on anything. We set aside a time for my scheduling coordinator to make these follow-up calls. And we have a system in place that allows her to do that. Okay, we didn't have to pay an outside agency to make these follow-up calls. And then I know some agents take a cut of when a patient is actually scheduled. All right. For me, for my practice, this is what makes the most sense when I have my own team doing these calls. And again, it works because I have a good system in place that allows my team to be consistent and holds them accountable for all the calls that have to be made. Whether you're using team or not, you need a system. I guarantee you, if you initially put in the time to put a proper process and system together that makes it easy for your team to do their work, it pays off big time. You're going to keep your hygienists busy, and they'll thank you for it, especially if you're paying them a base and a percentage off of production. Doing it consistently, you'll be able to build out your hygiene department, and not just that, you'll also be able to keep the provider, the doctor schedule busy. That's it for today, guys. I hope whatever I shared today was at least helpful to at least one of you. Keep tuning in, and until next time, take care.